The other one is the adaptive immunity. So before we proceed, let us differentiate first. What is the difference between the innate and the other one is adaptive immunity? Okay, so when we say innate immunity, we are referring to natural immunity, meaning to say it is naturally occurring. And since it is naturally occurring, the effect of the innate immunity geared, geared toward to non-specific pathogens. So meaning to say, um, when you are protecting yourself because when you are protected because of the of your skin as the epithelial barrier, your skin will protect you against any other kind of pathogens, non-specifically. Okay, unlike adaptive immunity is also known as the specific immunity. Okay, so adaptive immunity is also known as specific immunity because the type of protection that you have here in the specific immunity is actually acquired when you are exposed to a certain specific pathogen. So that is the reason why um, adaptive immunity is also known as the acquired immunity. Okay? Both of them are important. In fact, innate immunity is considered as the first line and the second line of defense. Whereas the adaptive immunity is considered as the third line of defense. Okay? And since it is the first line and second line of defense, for this particular chapter, we will be discussing your first line and second line of defense. The advantage, however, of adaptive immunity is that since it utilizes two types of lymphocytes, okay? So we have the T cells and the other one is B cells. So T cells are important for cell-mediated immunity, while B cells are important for humoral immunity. Okay? Both of them can actually produce a certain type of memory cells. And since they can produce a certain types of memory cells, then adaptive immunity, therefore, can participate to an amnestic response. Okay? So for today's meeting, however, we will be discussing the different types of innate immunity or the natural immunity. Okay, so for this particular chapter or overview, we will be discussing about the external defense system. These are considered as the first line of defense. And then, of course, we will also be having the second line of defense. The second line of defense, this would include the internal defense system. So under this, the internal defense system, there are actually mechanisms involved for the pathogen recognition receptors. And then we will also be secreting a certain type of chemicals in response to this infection or inflammation. So this is what you call the acute phase reactants. And noteworthy to mention here is the CRP, one of the most commonly requested serological tests, which stands for the C reactive protein. And we will also be discussing inflammation, though we have already discussed this during bacteriology, so we'll try to recall them. Also, the phagocytosis, and one of the most potent cells of our immune system, that is the natural killer cells, will also be included in today's discussion. Okay, so let's talk about the defense against infection. Okay, so when you say innate immune system, I have already defined this a while ago. It is our overall defense against infection. Okay? So when you say against infection, we are referring to microbial infections. And when we say microbial infections, it could be in the form of bacteria, viruses, fungi, etc. Okay. So this particular type of defense will immediately act, okay, whenever we are being attacked by a certain pathogen. Okay, so there is an immediate action. And there are two intricate systems that work to promote them. Okay, so we have the external defense system, and the other one is the internal defense system. So the external defense system mostly refers to the anatomical barriers. And then these anatomical barriers sometimes um, is also known as the epithelial barriers because this actually pertains to our skin, right? Particularly an intact skin. Because an intact skin, okay, is designed to keep microorganisms from entering the body. So if you will be if we will be recalling our histology, our skin is made up of stratified, squamous, epithelium, keratinizing. Okay? Keratinizing means that our skin is made up of a very hard substance protein known as keratin. And keratin allows our skin to be dry, and that particular environment will not really be ideal for the growth of majority of microorganisms. Though some microorganisms can still grow, but majority of the pathogens are being kept at bay because of the presence of the keratin. Okay? So the internal defense system includes cellular responses. Majority of these cellular responses refers to phagocytosis. Phagocytosis is very important because, as a matter of fact, the third line of body defense system will not even work without phagocytosis because an antigen presenting cells will not be able to display fragments of antigen through MHC class 2 without the process of phagocytosis. Aside from phagocytosis, there's another internal defense system that will allow localization of infection, and that is inflammation. Okay, so these two are very important, okay, mechanisms, okay, as part of our body defense. Okay, so let's talk about the external defense system. Okay, so the external defense system composed of physical, so chemical and biological barriers. So we have three barriers: physical, chemical, and sorry for that, and biological barriers. Okay. So when you say physical barrier, okay, this refers to the skin. Okay. This refers to skin. Particularly, we have keratinocytes. These particular cells obviously are important for the keratin that will play an important role to make our skin dry and intact. So that is keratin. So the physical barrier, I've been mentioning to you this a while ago, also refers to the epithelial barrier. Okay? So another physical barrier could be the respiratory airways because here we have the mucus, which can trap the microbes, and cilia, which can expel mucus. Kaya nga, whenever we have infection, let's say, let's relate it to COVID-19. When someone is infected with COVID-19, you would notice that that person would um, exaggeratedly in some cases produce more mucus, and primarily because of the fact that the mucus is actually a way of our defense mechanism so that it will actually trap microorganisms. And and the respiratory lining, so let's go back again to histology, is made up of pseudo stratified ciliated columnar epithelium. The pseudostratified ciliated columnar epithelium obviously has cilia, and then this cilia can expel mucus away. However, for those people who have been smoking, there's a chance that cilia will be depressed. So when you say a depressed cilia, it is actually not functional because of the too much exposure to smoke. So the mucus will accumulate, and that particular person will really try to cough hard. The smoker's cough, that's what we call it. And that particular person will not be able to expel microbes away. That's the reason why if you are a smoker, you are more predisposed to get a severe type of COVID-19. And so at this point, do not smoke. Okay? So biological workers, biochemical barriers would include lacrimal gland, salivary gland. So these are actually these particular glands. Lacrimal glands, for example, can secrete tears. Salivary glands obviously secrete saliva. And these particular secretions would have lysosine, and lysosine has antibacterial properties because this is very low in pH. Not to mention that when the organisms are able to reach the stomach has gastric acid, okay, which is very low in pH. In fact, from last discussion, we did mention that the acidity of the gastric juice can reach as low as 1. Can you just imagine how corrosive it is in the stomach? Okay? And then when you say biological barriers, these are things that we are doing in preventing the entry of microorganisms. So let's say, for example, coughing and sneezing. Yan, di ba? During the time when I was infected with COVID-19, I keep on sneezing. I keep on sneezing and coughing. Yung pala, sneezing and coughing are considered to be as biological barriers so that I'll be able to expel microorganisms away from my body. However, if a person keeps on coughing and sneezing, you get away from that person because that person is actually expectorating not just mucus, that person is also expectorating respiratory droplets that can contain millions of microorganisms, and that millions of microorganisms are actually infectious. And so that's the reason why wearing of masks and other PPEs are essential nowadays. Okay, so I hope that's clear. So external defense system. So let's talk about our skin. Okay, our skin is a physical barrier with secretions. And these particular secretions will discourage microorganisms from growing. It is not really ideal because aside from the fact that it is dry, it will constantly shed. Remember the layers of the skin? The outermost is layer, the stratum corneum. This particular layer is made out of dead cells, and we are actually shedding away these particular dead cells because the it's being renewed. Okay, since it is made up of a stratified squamous, so it's actually being renewed. Okay, and once we remove dead skin, we are also removing microorganisms. Okay, and it's really not ideal for the organisms to grow because of the presence of various glands, such as the sebaceous glands and sweat glands. So sebaceous glands will secrete sebum or fatty acid. Okay, sweat glands obviously will produce sweat, and the pH of these particular secretions are really not favorable for the growth of microorganisms. Now, if we will be looking again at the layers of skin, there are two main layers. We have the epidermis and the other one is dermis. So your epidermis is made up of tightly packed epithelial cells. Kaya nga katulad ng what I did mention to you a while ago, it is made up of stratified squamous epithelium keratinizing. Do not forget the keyword here, keratin. Okay, keratin will keep your skin constantly dry. And at the same time, it has a protective function over your skin. And then the dermis, on the other hand, is made up of different types of connective tissues. And these connective tissues are actually composed of blood vessels, hair follicles, sebaceous glands, sweat glands, and even WBCs. Okay, so then just imagine our skin. No matter what the color it is, our skin is very important. That is the reason why patients who have been severely burned are actually at risk of getting infection. Okay, so they are at risk of getting infection. So the skin, as what I've mentioned to you, has a lactic acid and fatty acid. Okay, so fatty acid, this is the sebum from the sebaceous gland, and they maintain the skin pH of 5.6. So 5.6 pH is acidic, and that is not really ideal for the growth of the organisms. Aside from that, our skin has also a psoriasin, okay, a small protein produced by skin cells, and this psoriasin has antibacterial effects. Okay, so that's just one, huh? Skin. So aside from the skin, we also have respiratory tract. Again, I introduced it to you a while ago that our respiratory tract, particularly the linings of our trachea, is made up of pseudo stratified ciliated columnar epithelium. If you recall your histology, the pseudostratified ciliated columnar epithelium has goblet cells. Okay? And these goblet cells can actually produce mucus. And mucus will block bacteria and other microorganisms from adhering to epithelial cells. It will entrap microorganisms. And because of the presence of cilia, whenever we cough or sneeze, cilia will propel away the mucus. And as it propels away mucus with entrapped microorganisms, we are actually moving out pathogens from the respiratory tract. So that's the mechanisms of our body. Okay, so I hope that's clear. Now, not only that, another part of our external defense system is our urine. Not necessarily the urine that we are excreting out, but the the physical process of urination. Okay, because whenever we void urine out of our genital urinary tract, we are also removing away potential pathogens. So that's another mechanism. And of course, the digestive tract. Our stomach's hydrochloric acid, again, recall histology. The lining of the stomach, one of the things that you will be able to see there are the parietal cells. Parietal cells are important because they secrete hydrochloric acid. And this is not just important for in the prospect of immunology, even in hematology. People without a sufficient amount of hydrochloric acid, will not be able to have a proper mechanisms for the absorption of intrinsic factor, and that those people without these mechanisms can have pernicious anemia. So I hope you can still recall your hematology. But in this particular context of our discussion, we could say that if people will not be able to produce hydrochloric acid, then that's a problem. Because hydrochloric acid is highly corrosive. And that being said, the corrosiveness of hydrochloric acid will even prohibit microbial organisms, microorganisms from growing. Okay? Now, our digestive tract, particularly in the colon, we have normal flora, or more specifically, we call it normal microbiota. So, for example, Escherichia Escherichia coli. Hello, bacteriology. So, Escherichia coli, the normal E. coli, not the ETEC, EHEC, EPEC, and and AAC. The normal Escherichia coli, this particular, some of the strains can produce bacteriocins. Okay, these bacteriocins will even prevent harmful pathogens from growing. Because normal microbiota keep pathogens from establishing themselves in this area. Why? Because normal microbiota has already established ecological niche. Therefore, since they have already established themselves there, pathogens such as Salmonella, Shigella will find it difficult to invade these particular organs. Though there are some still cases of invasion, but not as hard, but not as easy if these particular normal microbiota are present. So if you remember our discussion on in bacteriology, there is what one kind of bacteria, Clostridium difficile. Clostridium difficile is associated with antibiotic associated diarrhea because too much antibiotics will destroy the normal microbiota. And once they are destroyed, Clostridium difficile will actually propagate in your intestine, and that will result to colitis. And so it's very important, no? Normal flora are very important. So do not overdose yourselves with antibiotics. Do not drink antibiotics when it is not necessary. Okay, so let's talk about the internal defense system. So the internal defense system, these are our outline for the internal defense system. So let's talk about the PRRs, or the so-called pathogen recognition receptors. The pathogen recognition receptors obviously will recognize molecules, and these particular molecules are actually something unique to infectious organisms. What does it mean? It means that these particular molecules somehow will be able to identify will be able to have a mark so that the infectious organisms will be identified. So, for example, macrophages has PRR for a certain pathogens. Okay, so these particular PRRs are found in macrophages and dendritic cells. So, what can you say about these cells? These cells are examples of antigen presenting cells. Okay, they are also found in neutrophils. Why is it important for neutrophils to have PRRs? Because neutrophils is the first cell that will go to the site of phagocytosis. So that's why they are important. Okay? Eosinophils are also important to have PRRs because eosinophils will attack large microorganisms. They will attack large microorganisms, particularly parasites. Parasites cannot be phagocytized by neutrophils. They're too big. But microorganisms, WBC such as eosinophils can attack them. Then monocytes will eventually become macrophages, and they are also found in mast cells, T cells, and even epithelial cells. Okay, so that's what you call pathogen recognition receptors. So the pathogen recognition receptors, okay, they are encoded by the host DNA. So we are the one to encode it. And the primary purpose is to sense. So when you say sense, to recognize or to identify extracellular infection. So when you say extracellular infection, this infection out is still within the blood vessels. Because once the infection or the pathogens are already intracellular, that's another story. Okay? So, but when you say extracellular, so it's outside the cell, it is outside the cells, but within the blood vessel. So they can recognize the pump. So what are the pumps? Pathogen associated molecular patterns. So PRR, let me write it so that you'll not get confused, can recognize pumps. Where can we find PRR? In our cells, in our host cells. But where can we find the pumps? Pumps are found in microorganisms. Okay? So the most important thing about pumps is that when it is bound to pathogen, meaning to say a certain bacteria would have pump, then it can activate phagocytic cells. And when you say phagocytic cells, the number one cells that will be involved in phagocytosis are neutrophils or the past cells. Then monocytes could also be considered as phagocytic cells. Okay, I hope this one is clear, the PRR. So do not get confused. PRRs are encoded by the host DNA, while pumps are found in microorganisms. So one of the most common examples of PRRs are the TLRs, which which is known as the toll-like receptors. Okay, so do you know that we have 10 types of toll-like receptors in humans, and majority of them are found on the cell surface. So we have TLR here, and some of them are found here in the cytoplasm. So as you can see in the illustration, we have pumps that are designed for fungi. We have pumps that are designed for sorry, not pumps. We have TLRs that are designed for fungi, gram-negative bacteria, and even motile bacteria. Okay, and there are also pumps that are found, not pumps, TLRs. Sorry, there are also TLRs that are found in the cytoplasm, designed to recognize viral double-stranded RNA, viral single-stranded RNA, okay, and even bacterial or viral DNA. So we have 10 all in all in our body. Okay, so that is the toll-like receptors. So toll-like receptors are actually glycoproteins. Okay, so this is the chemical component of the toll-like receptors. Okay, they are bind to particular substance, and the effects of TLR is that they can activate cytokine and chemokine productions. They can, this is the action. The action of TLR is that they can activate chemokine and chemokine production and other processes. And the main effect is to enhance phagocytosis. So the chemical component of TLR, glycoproteins. Okay? And what is the main action? They can activate cytokine and chemokine. And the effect is to enhance phagocytosis. Therefore, the outcome of that effect is that They can destroy most pathogens that humans are exposed to even before the disease. Even before the actual war has begun, we have a preemptive response against these particular pathogens. So again, in summary, TLRs are chemical glycoproteins. Action, activate cytokines and chemokines. The effect is to enhance phagocytosis, and the outcome is to destroy most pathogens, like a preemptive response. So aside from the toll-like receptors, we also have other types of receptors, such as the CLR, okay, which can bind to mannan and beta glucans. Okay, so this is the action of the CLR. They can bind to mannan and beta glucans. What are these mannan and beta glucans? These are the chemical components of fungi. So it is found at the cell wall of fungi, by the CLR. So the action is the effect is to activate cytokine and chemokine production. So the outcome of CLR is to minimize or even prevent fungal infection. Okay, that is for the CLR. So TLR is mostly for phagocytosis, while CLR will actually minimize or prevent fungal infection. So other minor PRRs includes the retinoic acid inducible gene 1 like receptor, or the LLR, and the nucleotide binding oligomerization domain, or the NOD receptors. But among the PRRs, it is the TLR that is really important as our second line of body defense, because this one will enhance and promote phagocytosis. Okay, let's talk about the acute phase reactants. Okay, so acute phase reactants are actually soluble factors, mostly proteins. Okay, and it is found in serum. Okay, so acute phase reactants such as the C reactive protein will increase rapidly in response to infection, injury, or tissue trauma. Therefore, these acute phase reactants could serve as an indicator for infection and inflammation. Okay? These are being used by the physicians to assess, okay, because it serves as an indicator for infection and inflammation. Now, the acute phase reactants will facilitate contact between microbes and phagocytic cells. So somehow can also enhance phagocytosis. They can mop up and recycle important proteins after phagocytosis. Okay, so as what I've told you, the most important and the most commonly requested acute phase reactants are or is C-reactive protein. Because as you can see, it has the fastest response time, only 4 to 6 hours. So 4 to 6 hours after injury or infection, CRP increases up to 1,000 times. Can you just imagine within 4 to 6 hours? Okay? And the function is for opsonization and complement activation. Unlike other acute phase reactant, it will take about 24. So this is 1 day or 48 to 72 days, 72 hours. This is about 2 to 3 days before it can be detectable in the serum. So the fastest acute phase reactant is the CRP, or the C-reactive protein. So if you can see, no, the no, the normal value of CRP in our body is just about 0.5 milligrams per deciliter. However, CRP increases up to 1,000 times during infection and injury. So that's the reason why it is the most common indicator for, I like to say the word non-specific inflammation or infection. Why do we have to say the word non-specific? As a physician, the doctor will request for CRP, for example. And if the CRP is increased, then there is an infection or there's an injury. But he wouldn't be able to tell what kind of infection or what kind of injury because it is non-specific. Okay, so the doctor will not be able to tell that. But he can tell that there's an infection or an injury. Now, there is also another type of CRP. This is the high precision CRP. The high precision CRP is also being used by doctors to assess um, acute myocardial infarction. If someone has a heart attack, then the CRP will also increase. So that's how valuable CRP is. Okay. So let's discuss other types of acute phase reactants. So we have the serum amyloid A. It can activate monocytes and macrophages. And then the alpha 1 antitrypsin is a protease inhibitor. Fibrinogen, is our serum protein, can actually initiate clot formation. Haptoglobin can bind with hemoglobin. Ceruloplasmin is a copper transport protein, and at the same time, it can oxidize iron. And the C3 is the most abundant form of complement. C3 is the most abundant form of complement, and they are important for opsonization and lysis. Okay, so there you have it, the different types of acute phase reactants. Okay, so let's talk about inflammation. Um, Inflammation is the body's overall reaction to injury or invasion by an infectious agent. Okay, so that's inflammation. Why is it important? Inflammation is important because it will localize the infection. And once the infection is localized, meaning to say there is no systemic infection because we prevent we prevent systemic infection because we do not want to get into the systemic infection because it will be harder for us to control it. And at the same time, it is important for tissue repair, meaning to say we'll be able to achieve healing if there's inflammation. Like your love life, you will not have healing after a trauma if you will not feel the following. Most especially pain. Max, relate ba kayo dito? Okay. So pain is one of the cardinal signs of inflammation. So in Latin, we call it dolor, it or calor, swelling, edema or tumor, redness, rubor, and the fifth cardinal sign is actually the loss of functions, functionalasa. That's how we call it. Okay? So all of this process, a certain cell or tissue must be able to undergo to in order to achieve this one, healing. There's no pain, there's no healing without a pain. Okay? So that's the reason why this is a process that even a person would need to undergo to in order to achieve healing. Okay. So how does it happen? Inflammation. Okay. Let's say that this is the intact skin, And within the intact skin, we have blood vessels. So these are the blood vessels. Vessels, and this is the skin. Okay? So our blood vessels are made up of epithelial cells. We call it the endothelial cells. So what can you say about the endothelial cells? These endothelial cells are thin, simple, squamous epithelium. They are very thin, simple squamous epithelium. So during the process of inflammation, so this is the site of the injury, or this is the site of infection. So meaning to say there are many bacteria here. So during that particular process, resident macrophages and mast cells at the site of infection, ito yung macrophages, okay, it's not written, ito pala, ito yung macrophages, um, will release chemokines that causes vasodilation and induce selectins. So meaning to say, um, vasodilation will increase the lumen of the blood vessels. Selectins loosely bind circulating leukocytes and cause them to roll along the vascular walls. So the chemokines induce integrins on the leukocytes binds firmly to the endothelial cells. So that is what's happening now. And the integrins enables the leukocytes to crawl between the endothelial cells. So since the endothelial cells are very thin, they will actually undergo diapedesis. By means of diapedesis, these particular cells will be able to go out from the blood vessels and directly go to injury. Leukocytes then follow the chemokine concentration gradient to the site of, because chemotaxis literally means chemical attraction. So if this is the site of the infection, if there are many bacteria here, so the phagocytic cells will try to surround, okay, so that, and bacteria will not go and spread out of the body. This will not happen because there are now many pus cells at the site of the infection. That is the reason why kapag meron kayong pimple, and you have nana in Tagalog, but these are pus cells. Pus cells are trying to protect yourself, okay, yourself from further spreading the infection. Yung nana ninyo na nakikita, these are made up of WBCs trying to phagocytize the bacteria. So, ang gagawin nyo naman, in-squeeze ninyo yung pimples ninyo, sayang naman yung effort ng mga pus cells natin, ng mga neutrophils natin. Biro mo, nanggaling pa sila sa blood vessels just to go to the site of the infection. So that it will localize the infection. And once the infection is localized, it will not spread anymore. Okay, so that is inflammation. Now, phagocytosis will now involve cells such as neutrophils and monocytes. But the number one cells that will primarily go at the site of phagocytosis is the neutrophils. Why? Because they are not really that big as monocytes. And since they are not as big as monocytes, then they can easily undergo diapedesis. And these cells have TLRs, toll-like receptors. Okay? So aside from monocytes, we also have macrophages and dendritic cells. Yes, they are capable because they are considered as the antigen-presenting cells. Actually, we have already discussed this in bacteriology, but let's recall. So the first step in phagocytosis is adherence. Okay? So when you say adherence, there is a physical contact between the phagocytic cell and the microorganism occurs. And this is being aided by opsonins. Opsonins is actually an antibody that mediates in phagocytosis. So if this is the bacteria, then opsonin will try to surround the bacterial cell and this will mediate in phagocytosis. However, there is an exemption for adherence. That is if the cells have capsule. If the cells have capsule, then it will prevent adherence, such as Klebsiella pneumoniae, for example. Okay? Now, this is the second step. We call it engulfment. It is actually the outflowing of cytoplasm to surround the microorganisms. Or sometimes, engulfment is actually more appropriately described as cytoplasmic extension of the phagocytic cells. So there is a cytoplasmic extension of the phagocytic cells. Okay, so that's the second step. Now, the third step is the formation of phagosome. This is now a phagosome. And what can you say about the phagosome? Phagosome is characterized by the presence of vacuole in the cytoplasm. Okay? So the phagosome is important because it will really trap the microorganism. Because as you can see here, microorganism is completely surrounded by the part of the cell membrane. So meaning to say, they are completely entrapped. And beside the phagosome, as you can see here, there's another organelles known as the lysosome. The lysosome will be degranulated once the pathogens comes into contact. Okay? And it will now release the content. Okay? So, if there is a fusion, by the way, the content is actually known of the granules is acid hydrolase. It's highly corrosive and it has an antibacterial properties. Okay? So, the fusion between the phagosome, this is the phagosome, and the lysosome, they are now two become one. This is what you call phagolysosome. Meaning to say, the contents of the lysosomes are emptied into this membrane-bound space. So, step number 6 is now digestion. Okay, because of the hydrolytic enzymes known as the acid hydrolase. And there would now be excretion of phagolysosomes. They are expelled out of the body. So this is what you call exocytosis. So what would be the outcome? Microorganisms could be propelled away. Okay, so let's say that this is a macrophage. And a macrophage is an antigen-presenting cell. So what will happen now is that the macrophage will display the antigen so that it will be recognized by the CD4. So that's this is our lesson last week. Okay? So these are the steps in phagocytosis. Okay. Now let's talk about the natural killer cells. Natural killer cells are very potent cells, okay? Because natural killer cells is considered as the first line of defense against cells that are virally infected, cells that are infected with other intracellular pathogens, and even cancer cells. So in our text, you would actually hear or read the term LGL, and this one stands for large granular lymphocytes. So large granular lymphocytes large granular lymphocytes are actually other terms for natural killer cells, because we are taught that the two main types of lymphocytes are T cells and B cells, but there is a third one. Okay, so we call it the large granular lymphocytes. So they are very potent because the natural killer cells can easily recognize any damaged cell, can eliminate it without prior exposure to it. So there's no need for an amnestic response. Okay? Meaning to say, it will give us enough time, it will buy us time to activate our T cells and B cells. So they will really help our immune system, no? The natural killer cells. So that's how important they are. Okay? Natural killer cells are stimulated upon exposure to cytokines, and whenever these particular cells are activated, they will produce cytokines and the colony stimulating factor. So natural killer cells, though it is part of the natural immunity, it can also influence adaptive immunity because it will allow us to buy time before the T cells and B cells are activated. So meaning to say, during the time when the T cells and B cells are not yet activated, the natural killer cells can actually do the job of minimizing and preventing the infection from spreading. Okay, so the mechanism of cytotoxicity is like this. So by the way, let's define target cells. Target cells, target cells could be any of the following, huh? So do not get confused. So these are the definition of the target cells. Target cells could be virally infected cells, cells that have been infected with intracellular pathogens, or even tumor or cancer cells. Okay, these are our definition of target cells. Okay, so the natural killer cells, okay, can can actually um, can actually kill target cells, except if the target cells has an inhibition mechanism. In this case, there's no killing. Okay. So, however, if there's no inhibition, um, it will be activated and produce cytokines that can induce apoptosis or program cell death. The same thing can happen if the target cells are has been coated with antibody. It can also induce apoptosis. Okay? So again, when you say virally infected cells, these are cells that have been infected with virus, or a target cell could be also other cells that has been infected with intracellular pathogens. Okay, so that ends our discussion for that innate or natural immunity.